Some of Singapore's outstanding clinicians and healthcare professionals were honoured for their work this evening. They were presented the National Medical Excellence Award, which recognises the contributions to quality of care, patient safety, research and education. But joining us are two award recipients, Associate Professor Ng Kee Chong, who won the National Outstanding Clinician Award, and Adjunct Associate Professor Eugene, Shum, who took home the Team Award. Welcome, gentlemen. Thank you so much and congratulations. Prof. Ng, first to you. Back in 2017, you won the SingHealth Visionary Leader Award. Are your achievements today the culmination of something that was birthed back then?
Yes, I think at that time we were already moving forward to the vision forward that we want to. And in fact, now that the Minister has mentioned, has launched the Healthy SG program, at that time we were already making preparations to see how we can envisage a system to bring up healthier children for Singapore. And that has been a long journey, and it started off, of course, with Minister Gan with his three beyonds, beyond healthcare to health, beyond hospital to community, and beyond quality to value. And all these things are now encompassed in, Ministry of Health's Healthy SG program to bring up healthier children for our Singapore future.
Well, that must be very satisfying for you to see. There was a time, as somebody who helped to set up the Children's Emergency Department at KKH. Yes. When you look back, as we went through the entire COVID saga, and children being one of the most vulnerable groups out there, what were your first thoughts when you heard that COVID was coming to these shores and stayed as long as it did, which surprised us all, didn't it?
Yes. So we did have experience when COVID struck us based on how we performed during SARS, as well as H1N1 and ongoing concerns about bird flu and so on. But again, like you said, we were unprepared for the long journey, where we needed to battle COVID and keep our community safe. And I'm very proud of the whole team who actually really moved forward to actually take good care of our children and work very closely with the families to ensure that our children were well protected, both when they were admitted in the hospital, as well as when we discharged in the community to follow them up carefully. Also very proud of the team for working together for vaccinating our children. And we are going to start the vaccination, as you know, for the 6 months to the 4 years old. And this is a continual journey. And it's really been a learning journey where we have learned to come together. And I think we have become stronger for that, to keep everybody safe.
The experience that we had way back during SARS, during H1N1, Zika, how did those experiences inform how you handled COVID? Or has the pediatric experience of COVID been completely different and distinct?
It's been fairly similar. In pediatrics, in a way, we are quite used to all these normal non-COVID infections. Kids most of the time get sick from non-COVID infections like respiratory infections, gastric viruses and all that. So we're quite used to battling that. COVID itself, of course, what we learned from SARS was to expect the unexpected, to always be nimble, to always change plans, when it needs to be changed, and really be proactive in anticipating, challenges ahead, so that we can try to keep one step ahead of the virus and keep our people safe.
Prof. Shum, I do want to bring you in at this point. Your team at Changi General Hospital was key to winning this award, wasn't it? It sounds like they're very passionate, particularly about vulnerable elderly, and offering them what's called this urgent telecare through a 24/7 hotline, I believe.
Yes.
What gap does this hotline plug among this demographic, and how does it help us move towards a more holistic care model?
Yeah. Now, in Singapore, we have a rapidly aging population, and what it also means is that the number of seniors who are socially isolated or living alone is increasing. Now, when they are at home and something happens, they have a health or social care need. They might have fall, they might be feeling unwell, they might not have anyone to call, or they might not have anyone with them. This is where Careline is very important. Careline is an enrollment service. They register with us and we get to know them. we have their information. We call them regularly, check how they are, and they check in with us. So what is most important here is that we develop a care relationship. That means that when anything happens and we call them and they call us, we have their information and we are best able to support them.
So it's almost, as you said, a trust issue. And you actually begin to have relationships with these people, perhaps even outside the medical field that they were initially calling you from. I'd like to ask, because you have a very unique view. You have a bird's eye view of population health in Singapore. Okay, what on your mind is the most urgent need, aside from what you've already mentioned about social isolation? What else is urgent among this group of seniors, and are we on track to address that?
Yeah. Okay, so CareLine is a 24/7 urgent assistant telecare service. And thankfully, only about 3% of our inbound calls are for emergency care. So what we want to do, right, is for them to connect to us early. Now, we have a lot of services in the hospitals. We have the community care teams and so on. But we want to intervene early, right? So we have a very unique care model that we have. When the seniors call us, it could be for a single issue, or they might be calling us many times. What is most important is that we truly understand what they are calling about, right? And we look at the patterns of call. If it's just a one-off call, all right, not an issue. But if someone is lonely, someone has anxiety, right? They call us many times and we can see the pattern. In one extreme example, we had someone calling us every day, right? Even a couple of times a day. And the reason why they call might be quite simple. What's the time of day? Simple inquiries about the service. On its own doesn't add up to much. But when we string it together, we say, okay, there is an issue, right? And this is where we escalate it to our professional team. This is a team with healthcare and counseling expertise. Together, they deep dive into the case. We work closely with the Agency for Integrated Care and the elder care centers, and that's where we work together as a team to help them. So the key thing is that we want to intervene early, we want to help them, and not wait until the situation escalates, becomes severe, and they have to go to hospital. So it's about early outreach, early intervention.
Yeah, absolutely. I just want to also ask you to cast your expertise and your eyesight forward as we embark as a nation on this National Preventive Health Plan, Healthier SG, as you know. You both deal with the extremes of society, the very old and the very young, and somehow we've got to get everybody on board in this platform. So let's start with Prof. Shum. What role do you see your organization playing in getting what could be maybe a sticky demographic, when it comes to change on board this Healthier SG plan?
Yeah, I see a lot of synergy between Healthier SG and CareLine. And the similarities here is that we are looking at proactive preventive care. And the preventive care that we are talking about is in terms of physical, in terms of mental, in terms of social. So it's really very holistic in terms of the outreach. I think what we can see with Healthier SG is we can further spread the message of preventive care. And I think CareLine comes in very well here because we have built the relationship, the rapport. And, we can see how we can communicate this better to our seniors. And how it can benefit the seniors is that then, it makes them more aware of their needs. They are able to self-help better, get the care early, and this really helps them, to live well, age well, and continue contributing.
So you're going to sort of catapult or piggyback from this the telecare line to get them onto this new direction as we go as a nation. Yeah, I understand what you're saying.
A lot of synergies between the two, piggybacking each other.
And for you, Prof. Ng, when it comes to the young ones, the young ones, they're young. What's preventive care for a 2-year-old? So how do you plan to get this group, onto the Healthier SG platform? Yeah.
So the child and the family are the seeds of our future. They beget Singapore's future. So we need to start them young, influencing the family and the child, particularly in various healthy behaviors. foods, exercise, general good outlooks, healthy outlooks, including their mental wellness. I think that's a very key thing now in this complex world.
Yeah.
So we need to start young, and we start from the time that couples get married, have preconception, counsel them on the preconception needs to the conception, and then the birth of a child, especially as you know in the first 1,000 days, is very important to nurture them well. Then as the child grows into early childhood and into childhood and to adolescence, we need to continue to engender the right behaviors and help them to be healthy adults when they graduate. So I think that's the whole continuum from cradle to adulthood.
I understand. I understand. I thank you, gentlemen, as they talk to me in my ear, for your time and for your thoughts. And once again, congratulations.
Thank you very much. Thank you.
And I've been speaking with Associate Professor Ng Kee Chong and Adjunct Associate Professor Eugene Shum over there.